Wake up a little Susie.
Welcome to Courtney on Health. Max, take it over.
I'm taking it over. So here we are. Just another manic Monday, which is the days we tape. So hi, Courtney, and hi, Malcolm out in La La Land. Courtney nearby. Welcome to Courtney on Health, a Zoomcast podcast TikToky series, which focuses on one's overall well-being, with tips on nutrition and exercise given by none other than Courtney Gravenese, registered dietitian with a Master of Science degree in nutrition and applied physiology. Courtney is an experienced nutritional and health consultant in the New York metro area. And of course, that goes everywhere now. Even into the quantum entanglement
Quantum
asteroids,
leap.
and beyond. So, and she will help guide you on a path to wellness and health.
Yeah, by the way, I forgot to add that we're streaming on malcolmpresents.com. And we have all our shows on demand and archived.
Okay, we got all that stuff out of the way. So let's get to the topic at hand. Sometimes, Malcolm, I need that hook, I just need that hook. Anyway, so I don't know, somehow I've been starting shows, the last one and this one, with some lyrics from songs, because that's where my brain goes, because I'm a kind of musical kind of person, which some know and some don't. But in any event, this is some of the lyric from a song called Sugar Time by the McGuire sisters, very famous, three sisters who sang in the 40s, 50s, 60s, and this was a 1958 chart topper. And I just the first little lyric was, sugar in the morning, sugar in the evening, sugar at supper time. Be my little sugar and love me all the time. So we as humans, we all love sugar and we crave sweets. It's a craving. We all gotta have something sweet. But it is something we need to be careful about overdoing, because too much sugar can lead to medical issues, specifically diabetes, which is a serious condition where your blood glucose level is too high. It can happen when your body doesn't produce enough insulin, or the insulin it produces isn't effective. There's a high prevalence of diabetes in the US, very much so. Here's some stats by the Diabetes Research Institute. 37.3 million people, or 11.3% of the US population, has diabetes. That's incredible. An estimated 28 yes, Courtney will definitely talk about this in just a minute. An estimated 28.7 million people, or 28.5% of the population, had a diagnosis. I don't know how they don't mesh the numbers, or how they do, of diabetes. Approximately 8.5 million people have diabetes but have not yet been diagnosed. And that's as of 2022. So 1.545 million Americans are living with type 1 diabetes, which accounts for 3.75 of all diagnosed cases. It impacts all social, economic, and ethnic backgrounds. And many people we're going to talk about have prediabetes, which is where your blood sugar is higher than normal, but not high enough to be diagnosed as a type 2 diabetes. The exact cause of prediabetes is unknown, but it's associated with insulin resistance, as your cells stop responding to the hormone insulin. So Courtney picked this topic. It's a very, very important topic, and she's going to give us some information on pre-diabetes, diabetes, what to look for, and how to manage it, especially dietary, is important in this. And of course, Courtney is expert on that for sure. So start us off. How is this all defined, and give us some starting points.
Sure. So hello to both of you. So I thought it would be helpful to really focus in on pre-diabetes in particular, because just like so many other diseases and health concerns, the earlier you can nip it in the bud, the better the outcomes will be. So like you mentioned, Maxine, great percentage of Americans have diabetes. When we're looking at pre-diabetes, and I'm going to go through what the blood levels would be in order to get that diagnosis, but we're looking at about 96 million, that's with an M, adults have pre-diabetes. So that's about 1 in 3 adults. And we continue to see the numbers rising in our kiddos as well. So pediatric cases of prediabetes, depending on background, and if you look at other morbidities along with it, it could be anywhere from 20, low 20s up to about 40% of our kids. So it's a really difficult number to get your head around, because that's a whole lifelong exposure to what we know about what happens to the body when you are either with prediabetes or you are an individual with diabetes. So let's take a look at it. So your fasting blood glucose. So for those of you not familiar with it, and I think many folks are, so that is the blood test that is taken that typically, if you're lucky, is first thing in the morning after you've fasted overnight. If you are unlucky, sometimes you get it drawn later in the day, but you still have to be, fasted for, 8 hours or less. So
usually
it can be rough.
I'm the late. They never give me the morning.
I know it can be rough. I feel so badly, but nonetheless, the most accurate way to get it is if you are in a fasted state. So that's one test that they're going to take a look at. And in order to have a diagnosis of prediabetes, that fasting blood sugar is going to fall somewhere between 100 milligrams per deciliter and 125 milligrams per deciliter. And those numbers have shifted over the last decade or so. They really want to catch this earlier. So you might have heard a different number, many years ago, but these are the numbers that healthcare providers are working with right now. So there's the fasting blood glucose, fasting blood sugar. Sometimes those are used interchangeably. And then there's another blood test that's done. It's called the A1C, hemoglobin A1C. So the way I like to explain this is, for the younger generations, because everything is about social media, whereas the fasting blood sugar is a single post, so a picture, a snapshot of one moment in time, your hemoglobin A1C is a reel over the last 3 months. So in many cases, that A1C is going to give you a much more honest depiction of your glucose regulation. So one is a snapshot in time, one's telling you what the picture is looking like over 3 months. So many times you're going to see, particularly if that fasting glucose is elevated, your healthcare provider may at some point look at your A1C as well, as they should, because it can be a much more reliable way.
I mean, what affects those levels? I mean, I don't know if you're going to jump to that. I don't know if you want to go to symptoms or what, since you're talking about blood levels, what would affect those levels? I mean, there's so many things I would imagine that, I mean, is eating sweets just it? Is it your body? Is it your...
No. So we'll definitely talk about that. But
okay.
So absolutely, if you have had, and I just want to hop on this because certainly sweet foods, but not just sweet desserts. It's really all carbohydrate, particularly particularly starchy carbohydrate that are going to trip. And there's nothing bad about that. This is not a carbohydrate bashing session. This is just what carbohydrates do in the body. It's how your body responds to carbohydrates. In normal individuals, okay, and actually I can't say that anymore, right? In individuals who have typical metabolic responses, right? Your blood sugar goes up after a carbohydrate load, and then after some time it's going to come down.
Doesn't the starch, I remember like biology 101, that starches if you have an overload of starches, it turns into sugar.
That's right. So those are your starchy carbohydrates, as opposed to a non-starchy carbohydrate, let's say like greens, spinach greens. But the fact of the matter is, all carbohydrates have the ability to raise blood sugar. Now, there are certain ones that are going to raise it greater, and those would be things like, your sugary beverages, so your sodas, your sweetened coffees, anything that is sweetened with regular sugar, agave, honey, brown sugar. It does not matter what the nutritive sweetener is. They have the potential to increase blood sugar levels. So
how about
things like
how about the artificial sweeteners like Sweet and Low and?
No, they are not going to raise it as much, but they're continue to look at artificial sweeteners in terms of overall health risks, its role in insulin resistance. We can certainly go revisit that episode. Oh, by the way, if anybody's listening, there is an episode on artificial sweeteners and non-nutritive sweeteners. So go back and listen to that, but less so, which is why some people go from a sweetened beverage to an artificially sweetened one. But I would certainly caution that if consumed in excess. So we know that there's this response. So yeah, Maxine, those are the types of things that from a dietary perspective that can raise blood sugar, but certain medications can raise blood sugar.
Yeah, I'm on one that does that. And it's very specific in a side effect that it raises blood sugar. So when I'm taking a test, my doctors have to know that this particular drug, this medicine, is raising my level a bit, which is why my A1C used to be fabulous, but now it's slightly more than it was. But that's primarily due to medication, which, is
also, but typically your healthcare team is aware of those and might say, okay, it's elevated because of that. Pain can affect blood sugar levels. So, if you're in a hospital, healthcare providers are very much aware of this. That's why they're constantly asking about, where are you in your pain threshold? Because we know that pain can affect blood sugar levels. So yes, diet is definitely a component of it, but medications can certainly do it. Pain can certainly raise blood sugar levels. And we know that exercise in particular has a wonderful role in helping regulate that response to carbohydrate, which is why we're constantly talking about encouraging physical activity for a variety of different reasons, but one of which is helping regulate glucose response. So that hemoglobin A1C, if you think about it, it's a 3-month real video, of what's been going on in your body. If you think about it, so sugar enters the bloodstream from a variety of different sources. So whether that be flat out sugar from like a soda, or a roll that's been digested. So sugar enters the bloodstream and it attaches to hemoglobin. So that hemoglobin A1C is a percentage of red blood cells that have this sugar-coated hemoglobin on board. So hemoglobin A1C is measured in a percentage. And we know that individuals with pre-diabetes are going to have a hemoglobin A1C somewhere between 5.7 and 6.4. Above that number is correlated with somebody who has a diagnosis of diabetes. So these are not numbers you would know on your own, unless of course your finger's sticking at home, checking your blood sugar at home. And I do want, and it's outside of the scope of today, but I do want to do an episode on the trend of using at-home continuous glucose monitors for people who do not have prediabetes and diabetes, because there's really a lot of traction in their use right now. But again, we're talking about just
I didn't even know people would do that. That's something new to me. I never even heard of that.
Yeah, and I'll sort of tease that show about, so I think in individuals with prediabetes and diabetes, there is a real role for these, because I think for some individuals, they really do need to see how their body is responding to the foods that they're eating as an education tool. So I see a role there, a very important role in their use. I think for the average American who's just trying to figure out, again, outside of the scope of today, but I do wonder of the merits of it's there. And I think it makes people a little bit, a lot more crazier than they need to be about their glucose response. But anyway, there's a role for them, certainly in individuals with prediabetes or diabetes. So you got to know those numbers, just like so many other numbers that we encourage you to know: your cholesterol level, your blood pressure. The only way to really know if you are an individual with prediabetes is to know those numbers. So typically in adults, your A1C is going to be checked about 45, beginning at 45. Your fasting blood glucose, in all likelihood, whether you read the report or not, your lab report is going to be checked at your annual physical. So now sometimes they might not catch you when it's fasted, and they're able to look at that and say, this is not a fasting number. So you get a bigger number. So if you come in and you're not fasting and your fasting glucose is, 130, 35, your healthcare provider is not going to be that alarmed, because that would be typical. You've had a meal and that's a normal response. But that number would be, pretty much checked at any time you're having a blood draw. Kiddos don't have their blood tested as frequently as adults, typically every 5 years, unless a pediatrician sees something going on in your child that he or she wants to evaluate a little bit more. But don't expect to have your kids, thankfully, because nobody wants to bring their kiddo into a lab to have their blood drawn, every year. Rough.
They used to do it in the office, but now it's all you have to go to a different place. And I know, I mean, childhood diabetes is also on the rise, and everyone's got to really check for that. So I would assume
so like with so many of these things, but here's the silver lining of this, right? So if you can catch it, and if your doctor has told you that, we got to keep an eye on this. You got, technically you've got, pre-diabetes. It doesn't necessarily mean that you are doomed and you are going to ultimately end up with type 2 diabetes. So, very different. There are so many things you can do to keep that, blood sugar in better control. So certainly diet. And anytime you're reading information, it'll say, well, follow a healthy diet. But as we've discussed on these episodes before, that's going to mean something different to a lot of different people. The good news is, you don't necessarily have to follow a low carb diet. This we know. If you choose to, because that works for you, this is fine. It does mean you need to keep an eye on, first of all, the unhealthier sugary desserts, sweets, beverages, sodas, things like that, for sure. But it means you might need to just watch your portion sizes, mostly, not avoiding it entirely. Watch your portion sizes of those starchier carbohydrates. So bust out those measuring cups, not forever, just for a couple of times, just to eyeball, say, how much rice am I having when I have that? How much pasta am I really eating? You may be surprised. It might be 3 cups instead of the 1 cup that you think it might be. Keeping an eye on that would be particularly helpful. But there's lots of different dietary patterns that one can follow that would be considered beneficial to keep you from becoming an individual with diabetes.
Right, like the unlimited pasta bowls. I would stay away from that every month. They have like this bottomless pasta. It's like, I'm not quite sure, but it's something that everyone really needs to focus on more today, more than ever, because these numbers that I read off in the beginning are like, wow, that's a lot of people.
So let's talk a little bit about risk factors. So the risk factors for an individual with diabetes, they're fairly consistent with an individual with pre-diabetes, right? So let's take a look at those. So greater than age of 45, but that does not mean that somebody who's 30 cannot be diagnosed. That's, that would be incorrect. A family history, so that old gene pool that we talk about. So mom, dad, sister, brother, relative who's had type 2 diabetes, different than type 1. So the correlation is between type 2, not type 1. diabetes. So if that's in your family gene pool, again, it does not mean that you are necessarily going to get diabetes. It just means that you're at greater risk. We know that physical activity, if you're physically active less than 3 times a week, there is a direct correlation between that and your risk of becoming somebody with prediabetes or with diabetes. So again, we're not talking about necessarily weight loss, but this is, again, that regulation of blood sugar that we see with regular, consistent physical activity is really, really beneficial.
What about smoking? Does smoking, is that something that people have to really be careful about as well?
It's always very important. I mean, it is one of the top lifestyle factors that is controllable with support. I'm not lessening just how difficult that is, but it will worsen the complications associated with diabetes. It is not per se a cause of diabetes, but certainly we know that if you are a smoker, it's going to worsen, among other health concerns, the side effects and symptoms that you're having.
Right.
Aside from taking the test, what are the symptoms of diabetes? Let's say I don't take any blood tests or anything. Or are there symptoms in my body or how I feel that would tell me that I am pre-diabetic or susceptible to diabetes?
Pre-diabetes, not so much. It's a little silent. Individuals with diabetes may have increased thirst. So if you think about the way increased thirst, increased urination, they may have blurred vision. Blurred vision is really, that's not an early sort of symptom. It's more of a later onset one. But the word diabetes, if you think about it, so the sugar, it comes from the Greek derivative, is sort of, the sugar in the urine, which is why oftentimes you may have a urine test where they're checking glucose to see if you're spilling any glucose in your urine. So these are other types of things that you may experience, but that's more so with diabetes. You may or may not see those earlier on, which is why it's so important to know that number, particularly if you've got a family history of diabetes. Gestational diet, if you have a history of gestational diabetes. So for those of you not familiar with that, that is an increase in blood sugar during your pregnancy. Mm-hmm. So if you have that, you could be at risk for prediabetes. And if you've given birth to a baby that is greater than 9 pounds, which is a lot of folks, right? So it's a lot
of big kids out, a lot of big babies out there.
A lot of big babies. Again, it doesn't necessarily, I don't want moms like, oh my gosh, Melissa was, 10 pounds. That means no, it just means that these are sort of what we know about risk factors, and just be aware of those and piece them together. So if you have a big babe and you had gestational diabetes and your pop and your dad had type 2 diabetes, probably in the back of your head, you should say, I want to make sure I'm staying on top of this.
Yeah,
and I'm
getting in my religion, that's called an oy vey baby.
An oy vey baby. Yeah. Yeah. Well, some kids are just really big.
Yeah.
I like the 7 pound, like mine was like 7'2" or something.
Yeah.
That was a good size.
Yeah. So again, just, I think, as with so many of these things, so take a look at what you're eating, see where you can pull back some of these, beverages, your activity level. And we've touched on this. I know a lot about, it doesn't have to be a kickboxing class 5 days a week. That's not what we're talking about. It's getting up off your bum a little bit more, getting, sometimes preferably outside, but it doesn't have to be, for sure. Just being a little bit more active, get that heart rate up a little bit, and each small step you make towards that goal is a motion in the right direction. So that will certainly decrease your risk.
Right.
I mean, now what do you do if it's not caused by lifestyle? It's generic.
Genetic.
Genetic.
It's not generic. Yeah. Genetic.
Generic. Oh, okay.
Well, it still has to be controlled. It is not uncommon And so first of all, to communicate with your healthcare provider. He or she is going to guide you. It is not uncommon for an individual with prediabetes to be put on a medication, and I'm just throwing one out there, metformin. So to keep that number in check, but lifestyle factors changes always need to be part of that. There's a large, the diabetes prevention program for anybody who's interested, and I strongly encourage you, and when I do my post, I'll make sure the reference is in there. There are many hospitals around the country that are offering this program. It is I believe it is a free program. It's called the Diabetes Prevention Program, the National Diabetes Prevention Program. You can look into it, get the resources you need, the support you need to help you. And they talk about those lifestyle factors that can be changed in order to help reduce your risks. So certainly look into that.
Yeah, there's a lot of sites, including, diabetes.org, the American Diabetes Association. They have the research, Diabetes Research Institute, and there's a lot. I mean, you just could go online and get the information. That's one thing about these days, being able to quote unquote Google something. And sometimes it gives you good information, and sometimes the medical information you get scares the hell out of you and could be wrong. So you need to talk to your doctor, because that's probably a whole show. Like, should you get medical care from the online doctor thing?
Absolutely. I could not agree with you more, Maxine. It's so important. I know we all go to Professor Google and Dr. Google for a whole host of topics. But your healthcare provider, your doctor, will know you best and knows much about your history and the medication you're on and supplements that you're on. So you really need to rely on that. Let's face it, right? I mean, there's a reason why they spend a lot of years. You got to trust that expertise, right? So go with that. And he or she will guide you in the right direction. Now, having said that, if you've been put on a medication and you are miserable, speak up, be your own advocate. Like, listen,
because
this is not working for me. There's got to be something else.
Yeah, I've done that in the past, and they had to switch meds. I mean, if you're not doing well on a med, not everybody, everybody's body is different. So, how you acclimate to the medications is going to be different. Like, my brother was able to take a statin, but I couldn't. So they had to put me on something completely different. So you just gotta, your doctors should, know your background and history, and then they can give you the right stuff.
The frightening thing about medication is, I don't know if you've seen the ads on television. That they do 15 minutes about what what happens to the body, and then the other 45 minutes for disclaimers.
Right.
If you take this, you might die of a heart attack. You might get a stroke. You might stop breathing. You might become impotent. There's so many things that happen.
You might become impotent. That's the one we're looking for.
But
you're
to
almost
that
frightened
point
to
now,
take it.
all the more reason why an honest conversation with your doctor, and then they can say, okay, listen, these are the risks, these are the benefits, and let's weigh all those out. And that's always there's not a single medication out there that has zero risk. None. It doesn't exist. So it's always this risk benefit that you have to evaluate. And speaking of medication, because I know we're pushing up against our time, and I said that I would mention these because I feel like you can't get away from them right now. And it's the whole line of GLP-1 agonists. You guys may have heard about these. This is it's called glucagon-like peptide 1. And in particular, there are those that are helpful for individuals with prediabetes and diabetes. They're approved for individuals with diabetes, and they appear to be very, very effective. The one that's off the top of my head is Ozempic. Talk to your healthcare provider about it as a potential option, but I have to say, all of these medications need to be taken along with the lifestyle changes. None of these are take the pill and go right back to the way you were eating and your lack of physical activity. It can't be. It has to be embraced entirely. And the other thing about these GLP-1 agonists is that they are very, very expensive, and a lot of insurance companies at this point are not covering them. So you need to go in with your eyes open, that even if your doctor believes it is perfect for you, he or she is not magical and can't produce it, and it's going to be expensive. So just know your options
Right.
that are available to you, and know that, and I want to make sure the message is clear, pre-diabetes does not necessarily mean you will become an individual with diabetes. It just means this is the flare. The flare has gone up, and you need to sort of follow that flare and figure out ways to, you know, prevent any further disease progression.
Yeah, I mean, also a lot of some of these medications, and you mentioned Ozempic, they're used for other things. Like I think there was
Right.
people are losing weight.
Mhm.
And so now it's not only for the intended purpose of lowering A1C, but losing weight. So
Right.
I don't know, they're getting hold of it for that reason. And it's just Dodge City sometimes
Yeah,
out there.
aside from
Right. So,
medication,
but yeah.
Go ahead.
So, and then you mentioned it, and those were the last two risk factors that I want to talk about, was being overweight. And we can do a whole episode on PCOS, which is polycystic ovarian syndrome. These individuals may be at greater risk for pre-diabetes. So, you know, being aware, if you are someone who's overweight or who's somebody who is obese, you want to pay attention. And also if you've been given the diagnosis of PCOS.
Yeah,
anyway,
so
if you hear the little beep, that means our time is up.
That's
we
it.
he- we
That's
hear the
it.
beep. We gotta wrap, as they say.
Yeah.
So yeah, great information, Courtney. This is a very important topic, as all of them are. But just looking at those numbers, I was like, what? You know.
Yeah.
So anyhow, thanks for
Yeah.
joining us for Courtney on
Okay.
Health. To get more info, go to Courtney on her Facebook page, which is Courtney on Health, on Instagram and TikTok at CLG Wellness, and visit her website, CourtneyGravenese.com. For past shows, go to MalcolmPresents.com and theManyShadesOfGreen.com. This has been Courtney on Health, smart, sound nutrition, strong, safe fitness, and we'll catch you again next time.
Yeah. Thank you very much, Max. Thank you, Courtney. We'll see you next
Have a
week.
good day.
Take care.
Bye.
Bye.